It's really easy to see why we had such a high response rate. And that's the simple fact that we see struggles, we see pain, and we see the outcomes of the pandemic every single day. And as a mental health clinician, the truth is it's a humbling responsibility. I'm Dr. Sarah Stewart-Spencer, and I'm the Dean of Behavioral Sciences at Yorkville University. This survey is a collection of 2,200 voices of the frontline mental health workers across Canada. This was a survey to find out more about their feelings, perceptions, and thoughts coming out of the pandemic, and also to get an understanding of what's happening on the front lines so that we are always in touch with current relevant happenings of our community. The main pieces that we learned from this survey is that we're all connected and we're all affected. We felt this on a global scale. 92% of our respondents talked about the traumatic scars that were left behind from the pandemic. The good news is that trauma-informed care has been integrated into our practice and curriculum so that we can make sure our students are ready to meet the needs of the community. The other piece that really stood out is our access to mental health continues to be a concern. So we need those frontline workers. We need counselors ready and able to serve in the community so we can decrease wait lists and get to the heart of the concern for others. There are really three findings that came out of this survey that we could really consider something positive in looking for change. And the first is that we truly have a global connection. This is the moment when others understand the sense of fatigue and stress that have happened because we all experienced. It's not province specific. It's not even country specific. Globally, we all understand the struggle of what we went through. The other two pieces center around the expansion of virtual health, what a difference that has made. And it expanded our field and our influence to really touch those who didn't have immediate physical access. And the third point would be the hybrid flexible work policies that we see coming out. Instead of just a hard return to work and being back in the office 5 days a week, we're really seeing some flexibility around this hybrid model, and our respondents see a really positive change coming from that flexibility. I have to say none of it's new. None of it surprised me at all, because the reality is we work really hard here to stay connected to the front lines. We also want to make sure that we're always in tune, understanding what's going on so that we stay relevant and that we are practicing and training our counselors to be ready to enter the field immediately. It's really important to me that we take a moment to say thank you to our community. Thank you for taking time to respond, share your thoughts, share your insights. It's so crucial for us to know what's happening on the front lines. And on behalf of Yorkville, we recognize the sacrifice, the time, the energy that you have put over the last few years of meeting the needs of our community. And we truly hope that what we're doing to prepare for our future will continue to support you.